Thank you. Good morning, everyone. I'm very pleased to be here. Traveled yesterday from the United States. I live in the state of California, which probably most of you know is on the West Coast. And the state of California happens to be the largest state in the United States. And approximately 15% of the United States population lives in that one state. So I'm going to talk a little bit about some of the things we've learned about school meals from the state. But before I do that, let me thank Bodil and the other conference organizers. When Bodil reached out to me 2 years ago, I was all excited to come to Norway as my first time in this wonderful country of yours. And I was very sad when it got canceled because of COVID, but I was even more impressed that the conference continued the second year we were going to come, and then the third year. So I'm very pleased that we finally got to be together. So I'm going to share a little bit with you today about what we have learned in the United States about school meals. And I'm looking forward to learning from all of you how to address some of the problems that we still have in our country. I'm going to talk about the impact of school meals on student nutrition and health from the experiences of the United States. I'm going to start a little bit about the history. I know in Norway you are about to begin a school meal program. We've had a little bit of more time implementing school meals, so I wanted to share what we've learned and how those school meals came about, why they were needed, who gets reached by them, and how that has changed over time, and also what foods and beverages we serve in the school meal programs in the United States. I'm going to talk about some studies that have shown what the costs of the school meals are and also their benefits, a little bit about nutrition education, and then I'm going to end with how school meals have evolved over COVID, because they have continued during the pandemic. And you call it coronavirus? Is that what you call it? We call it COVID-19, so that's our shorthand for that. But that's what I mean by the pandemic. So the evolution of school meals in the United States. Interestingly, the topic of school meals became politically on the agenda in the 1930s after World War I. The Great Depression was something that probably impacted all of us, but especially in the United States, there was a lot of concern about feeding children when the Depression hit and incomes were so low and there was a lot of hunger in our country. The other thing that was a concern in the United States was sustainability of farms. So there was a lot of farmers who were going under, who were not able to sell their crops because people didn't have money to buy them. And rather than have those crops go to waste, the idea was, can we do something with those farm crops and also help feed children? So in the 1930s, school meals began, but they were just on a very local level. So certain cities, municipalities, school districts saw that their children were hungry, that they had farm surpluses, and they started them on a very local basis. It wasn't a federal program at all. In the 1940s, there began more debate in the legislature about whether we should have school meals in the United States. Interestingly, the problem now that was largely politically being addressed was farm surpluses. So there were still a lot of farmers growing crops that weren't being sold, and they wanted to figure out what could they do with those surpluses so that they could support farmers and keep them in business. And that was the beginning of the National School Lunch Program, passed in 1946. It began very small. There was small cash grants given by the federal government to schools, and then a lot of the farm surpluses, a lot of the commodities. Now, I'd like to say that the student health was the biggest concern of the legislature at that time, but it was not the case. That has changed over time. Now it is largely viewed as a program for student health as opposed to farms. But in those days, the Surgeon General, for example, talked about student health. In the United States, we have a head in the White House in the government, a head health minister, that is the Surgeon General, and at that time his name was Thomas Parrin, and he said the committee will recall when he was speaking to a House committee, the legislature on agriculture, that part of the federal government, the first action on the part of the federal government in connection with this problem, meaning the problem with farm surpluses, was disposal of those surpluses. But he said, I hope all of us agree that the major objective is to improve the health and physical stamina of our children. So there was a small contingent that were saying, yes, we need to focus on the health of students. But most people were saying what Representative Cooley was saying at that time in 1945, the main objective is to dispose of surplus agriculture. So interestingly, that's how we started. It was all about agriculture, and that is why you may not be surprised to know that the federal administration that oversees the school lunch and breakfast programs is the U.S. Department of Agriculture, not Health and Human Services, not education. It's all in the agricultural division in our country. So how did things progress? Well, in the 1960s, when I was born, there became a movement to focus more and more on the health of kids. And what was noticed is that many kids in lower income schools were not having access to meals. At that time, in 1946, the meals were subsidized, but students still had to pay for them. They weren't free. And so there was a call to make meals free to students who could not afford to pay for them. And there was also a call to create a school breakfast program. So the lunch program had been already created 20 years earlier, and now this school breakfast program was created. The other thing that happened in the 1970s and 80s, though, and I don't know about politics here, but in our country, they go up and down. They go right to left, right to left, right to left. So in the 1960s, very progressive, let's give school meals to students. The 1970s and 80s, Ronald Reagan came in to be our president, and the idea was, no, we shouldn't be supporting school meals so much, we should privatize it. And so there was a dip, a decrease in funding for school meals, proposed funding cuts, and Congress proposed something called block grants. Block grants is where instead of the federal government supporting the school meals, each state gets a certain amount of cash and they can use it in different ways. And the concern, and block grants are again, have come back and forth. They've never actually been implemented, but there's voices, calls for them from time to time. The concern is that then the states can use that funding for something else. They don't actually have to use it for school meals. So those of us who are progressive say, no, 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 don't block grant it, keep it federally funded. Those who want to reduce the size of the program say, let's block grant it and let's eventually get rid of them. The 1990s and 2000s is when there began to be something called dietary guidelines for Americans. And I don't know if you have those in Norway, but every 5 years, the federal government puts together experts, nutrition experts, convenes them, they work on this for a whole year, they look at the literature, the scientific evidence, and they create dietary guidelines. And the dietary guidelines are then used for all of the nutrition assistance programs in the country, including the school meals. So there was calls for these dietary guidelines, to change the composition of the school meals, recognizing that students had a lot of nutrition problems, mainly fruits and vegetables and whole grains. Those were really low, and they remained very low. And in addition, the federal government recognized that there was still a lot of hungry children, so they created 2 more programs, an after-school snack program and a supper program. So depending on what school you're in, you can get a breakfast, a lunch, an after-school snack, and a supper if you stay late at school and get cared for, after-school childcare, essentially, after the school is no longer in session. The other thing that was created in the 2000s was something called the Fresh Fruit and Vegetable Program. So I mentioned that one of the things we noticed from national surveys is that children weren't eating enough fruits and vegetables. And the idea behind the Fresh Fruit and Vegetable Program was to create a snack, not at breakfast, not at lunch. It has to be in between breakfast and lunch or after lunch, where children only got fresh fruits and vegetables. We are a country of a lot of processed foods, and the idea was that instead of giving kids processed fruits and vegetables, it had to be fresh, connecting them to farms, connecting them to the agriculture. So if you happen to be in a school that gets the fresh fruit and vegetable program, you also have access to a snack during the school day. What you can see over the history of the school meal program is that there has been a huge increase in uptake. What this represents is the number of children served by lunches in school daily, starting in the 1950s when the program began. Only about 7 million children were served. And up until now, it's about 30 million children served. Now, you may say, does that mean more children are eating the school meals? Yes. In the 1950s, only about 24% of children took part in the school meals. In other words, you can have it, that doesn't mean all children will eat it, right? But in the current times, it's about 60% of kids eat the school meals. So this increase, this linear increase that you see is not only due to the fact that we have more kids in the United States, but also because more children are participating in the school meal program. And it'll be interesting to see, I wanted to ask the students how many kids actually eat the breakfast, but probably because it happens after the bell, we call that after the school bell starts, more kids are eating it. In the United States, most school breakfasts happen before the bell. So it's before school even starts, the cafeteria opens, and students have to arrive early in order to eat that meal. Otherwise, school starts and they may not get there in time. All right, so what happened next after the 2000s? Well, in the 2010s, there was something called the Great Recession. You probably had that here as well. A dip in our economic vitality, and there was a focus on two things with respect to children, and this was largely a movement created by President Obama. The two things that were going on simultaneously is we had an increase in student food insecurity. That's, do you use that term, food insecurity? Okay, so it's hunger, but it may also just be inadequate access to food because of income. At the same time, we in the United States lead the world in child obesity. We have the highest rates of child obesity. Mexico tries to beat us once in a while, but most of the time the United States is on top, unfortunately. So we had these two dual problems, and President Obama was able to get into legislation something called the Healthy, Hunger-Free Kids Act. So healthy because of child obesity, hunger-free because of food insecurity. That changed the standards for the school meals, and I'll talk about that in just a minute. It also implemented regulations on something called competitive foods. So I talked about all those federal programs, which includes healthy snacks, school breakfast, school lunch, after-school snack, supper. Schools also, many of them, offer something called competitive foods. It's called that because it competes with the school meal program. So schools could have a snack bar, for example, and sell all kinds of things, sometimes healthy things, but most of the time very unhealthy things. So President Obama enacted legislation to try to make those competitive foods more healthy, because what we were seeing is that a lot of kids would skip the school meals and go for those unhealthy snacks instead. The other thing that happened is something called community eligibility provision. So up until this time, kids could pay for the school meal. How much did they pay? A couple dollars. Or they could get it at reduced price if their family income was within a certain lower level, or they could get free meals if they were very low income households. Community eligibility provision allowed a school to provide free meals to everybody, regardless of income. What is the benefit of that? Believe it or not, this might not surprise you, there's a lot of administrative costs if you have to figure out who gets free, who gets reduced price, and who pays. Every single meal has to be counted because the federal government reimburses different amounts for each of those types of meals, and every child needs to apply for the program. So there's lots and lots of what we call red tape, bureaucracy, paperwork, oversight. If you provide all meals free of charge, all that, not all of it, but most of that paperwork goes away. And so school meals can actually be provided at less cost because there's not somebody marking all those boxes all the time. So that was the idea behind community eligibility. I just wanted to show you a little bit about the prevalence of food insecurity and why President Obama was able to get that Healthy Hunger Free Kids Act passed. What this graph shows is the households, the percent of households in the United States that were food insecure, meaning they didn't have enough money to purchase all the foods that they wanted to eat. The dark blue line is for all households, and what you will see is over time, consistently, the households that have children have a higher rate of food insecurity, meaning it's harder for those families to make ends meet. And during the Great Recession, that box in the middle is when food insecurity really increased, and it helps politically make the case to make sure that the school meals were healthy, and also to make sure that some schools could provide them free to all students. Interestingly, over time in the United States, and this will be interesting to see how this changes with school meal provisions in Norway, this shows the billions of lunches served every year, and I've already shown a similar graph as the dark blue bars, showing that the numbers have increased as more and more students have been participating in the school lunch program. But the red line is what I want to point out to you here, is that's the percent of students who get the meal for free. And what you can see is that in the 1950s, 1970s, shown here, it was very few, or a small percentage of children. When the program began, for example, only about a quarter of children were low income. A lot of the children were, not low income. But in today's 2020, over 60% of the kids who participate in the school meal program are low income. Why do I bring that up? Because over time, the school meal program has, the average Joe, it is a program for poor people. So there is stigma attached to it. And there's some kids who feel very ashamed that they have to take part in the school meal program. So I'm hoping that you can avoid that in Norway and not make it a thing that is for poor people, but for all children. I wanted to spend a little bit of time. I was interested to hear what a school breakfast in Norway is composed of. Our breakfasts and lunches are somewhat similar. This happens to be the nutrition standards for the lunch meal. And like I said, thanks to President Obama, they were updated in 2010. Those changes started going into effect in 2012. President Trump wanted to reverse some of those changes, but luckily he was not successful. And so some of those changes are still being phased in over time, particularly with respect to sodium, which I don't show on this slide, but I'll mention that there are different sodium targets. In the United States, we have a terrible problem with sodium. Our intakes are double, triple what is recommended. And so we're trying to reduce sodium intake over time, and one of the ways is through the school meal program. So just to show you what happened in 2010, more fruits and vegetables. It used to be a half to a 3/4 of a cup per day. It's now broken down into vegetables and fruits. The reason being that before these standards took place, a lot of times what schools would serve was a lot of fruit and not very much vegetables. Vegetables are less popular. Now you have to serve some of both. They also have weekly requirements. We in the United States eat a lot of potatoes. So the goal was to get kids to eat other things, other types of vegetables besides just potatoes. So dark greens, orange vegetables, legumes, or beans. We eat, compared to recommendations, too much meat and too many grains. So you'll see the sizes of meat and grains decreased. In the United States, we eat almost always refined grains, so white rice, white bread, not whole grains. So you'll see that the new requirements are half grains be whole grain or whole grain rich. And then milk. The amount of milk didn't change, but the fat content changed. So now milk has to be 1% fat or non-fat milk. So what happened next? Well, you all know the pandemic hit. And one of the interesting things is, as much as I bemoan all the negative things that happened during COVID, one of the positive things of COVID is it really highlighted to the general public how big a role the school meals were playing. So right now, school meals are more popular and more supported than ever before because it was recognized that when people lost jobs and were unemployed and couldn't go to work and children were hungry, one of the places they could get meals was at schools. In fact, even when schools were closed, almost all the schools still maintained their school meal program. How did they get those meals to students? There were things, distribution centers set up. So even if a child didn't live close to school, they would have central areas where kids could come. The family could come once or twice a week and get meals for the entire week, packaged up for them in big bags that they would take home. School buses, instead of picking up kids and taking them to school, they would bring the school lunches. So there was a lot of creative energy put into figuring out how to feed kids, even if they couldn't physically come to the school program. The other thing that happened is the legislature enacted school meals free for all. So before I talked about how some would get it free if they qualified based on income or at a reduced price, and some would pay full price. Now, regardless of who you were, you didn't have to put in an application, you didn't have to tell anybody anything about your income. Everybody who drove up to get a school meal would get it free. In fact, you didn't even have to be at that school. So if the school that I went to was farther away than another nearer school, I could go to the other school and you just drive up and you get the free meal. The other thing that the government did was something called pandemic EBT. EBT stands for Electronic Benefit Transfer, which is a fancy name for pretty much a card, like a credit card, that you can use to get food. You can go to the grocery store, you put your card in, and it'll give you, it's like cash. In the United States, we have something called the SNAP program, Supplemental Nutrition Assistance Program, or food stamps, and low-income families would get a card. Well, they get money added to their card every month. During the pandemic, there was a special increase in that amount during the summer when kids wouldn't be in school to try to mitigate food insecurity impacts during the pandemic. All right, so how did COVID do? How did the schools do in terms of meeting the needs of students? You can see it was a significant drop. There was about 30 million lunches served daily before the pandemic. That went down to 22.4 million. Not perfect, but we in the school meal world think that schools did a tremendous job in making sure that many meals were still served. However, we have some problems. I already mentioned that the United States leads the way in child obesity rates. This is from a cohort study of children measured in 2018. The same children followed over time in 2019 and then 2020. And what you can see is this alarming increase in BMI. In fact, the rate of increase, now I'm sad to say, because I've been doing this work for 30 years, child obesity prevention, and the entire time I've been doing the work to prevent obesity, obesity has increased as recognized by those increasing slopes. But during the pandemic, it really increased. The top blue solid line is for the severely obese children. Those are the ones that have a BMI above the 97th percentile, so at the very top edge. But even among the overweight children above the 85th percentile, we saw increases in their BMI. And in fact, even among the underweight children, we saw increases in BMI. The long-term effects of this, we don't know yet. We haven't yet got data out nationally to see, are the BMIs going to go back to where they were before? Are they going to keep going up? Or are they going to stabilize? I don't know the answer to that. But we obviously have our work cut out for us. The good news is that the school meals have a lot of benefits. So we're hoping now that kids are back in school, they will realize some of those benefits. But I wanted to start off by talking about the costs. As you in Norway start thinking about what it's going to cost you for school meals, hopefully you can learn a little bit from our examples. What this bar graph shows is the amount, or the percent really, of expenditures the federal government puts out for different nutrition assistance programs. I already mentioned SNAP, the food stamp program for low-income families. We also have something called WIC, which is a food benefit program for women, infants, and children, pregnant women and breastfeeding women. And then there's the National School Lunch Program and the National School Breakfast Program, and they represent about 1/4 of the national expenditure. How much does that equate to in dollars? So again, remember 30 million kids. It's about $14.2 billion per year that the federal government pays for the school lunch, and about $4.5 billion per year that the federal government pays for the school breakfast. And I say the federal government pays for this. They get their money from taxes. So this is taxes on people and goes to the federal government, and then the federal government provides the funds for the school breakfast and school lunch. I think the translation to kronen is about $1 to 9. So I've, in my head, been multiplying by about 10 so that you can translate that into kronen. In terms of per meal reimbursement, this is how much the federal government reimburses schools. So for every free school lunch that they give, that the school gives out, the federal government will give them $3.66. If it's reduced price, it's a little bit less. They also give a little bit of money for paid lunches. Why do they do that, you might ask? Well, it turns out, and I'll talk about this in a little bit in just a second, that most schools don't break even. In other words, this is not enough to cover their costs. So that's why there's a little bit of money given even for students that also pay. And you see the numbers there for breakfast. So how much does that reimbursement cost? The green bars here show the amount that schools say they spend, $3.81, but they get a reimbursement of $3.32. $2.72 they spend on breakfast, they say, and they only get $1.88. Where do they make up the difference? You remember I talked about those competitive foods that schools sell? That is where many of the schools make up their difference, by selling those alternative snacks. But even so, on average, only about 97% of the costs of the school meals are covered by the federal government, meaning that most programs run in the red, and funds from other school financial resources cover the amount that the federal government does not. So a warning to you, that tends to be a problem, and it tends to be a problem for schools that then don't want to participate in the program. I should have mentioned this, and I didn't, that it is a voluntary program, so not all schools have to participate. They can choose not to. They can choose not to have a school meal or school breakfast, a school lunch or school breakfast, but about 95% of schools participate in the National School Lunch Program, and about half of that number participate in the school breakfast program. One of the interesting things about the school lunch, and these data are even before the Healthy Hunger Free Kids Act, the new nutrition standards went into place, is that, and I know you guys have more lunches, or most lunches, are kids bringing them from home, right? As opposed to the school providing them. It's different. It's the opposite. About 60% of kids eat the school lunch, and about 40% will get it from somewhere else, from home or elsewhere. But when you compare lunch from elsewhere versus school lunch, and again, even before those updated nutrition standards happened, the school lunch was by far nutritionally superior to the average school lunch from home, the average lunch from home that was eaten at school. The lunch from home has about 60% more calories, more fat, more saturated fat, more sodium, more added sugars, and less fruit. In 2014 to 2015, and this particular study was supposed to happen again during the pandemic, but it's been postponed, there was a national study to understand the school lunches and what was being served in all of them, and the school breakfasts. And what we found was that thanks to the new nutrition standards, the average diet quality of the meals increased significantly. These data shown here are something called a healthy eating index. It has 12 different components. It includes calories and saturated fat and sodium, fruits and vegetables, whole grains. A whole bunch of different components go up into a score that ranges from 0 to 100, 100 being the absolute best diet, 0 being the absolute worst. On average, Americans eat around a 50 to 60. You would get an F or a D, I guess, depending on how you grade. And that's what the school lunches and school breakfasts were before the nutrition standards were reformed. But now you'll see the scores have increased significantly, meaning that the quality, the nutritional quality of the meals has improved dramatically. And if I have one piece of advice that I would give to Norway, is start out with good nutrition standards. Because every time you make a change, you've got to get a lot of people to buy into that change. It would be easier to start out with a high quality, nutritious meal than to let schools do as they would and then try to change them later. The impacts of those school nutrition standards, so I mentioned those started in 2012 and have been phased in over time. We have now a lot of evidence showing that those changes resulted in children's intake of more fruit, less fat and saturated fat, less sodium, more limited evidence for total calories and for body mass index or weight status, but a lot of evidence showing positive impacts of those higher nutrition standards, which hopefully will be achieved when you implement your school meal program. We also see that the school meals contribute to overall diet quality. So this is a study that we did, actually, my lab group did, and we found that kids that ate school meals every day as opposed to less than every day had more fruit and vegetable intake, more whole grain intake, more dairy intake, and more fiber intake. Meaning that the school meals, because kids can get up to half of their calories from breakfast and lunch, can contribute to the overall diet quality and the overall health of kids. One of the things that we try to pay attention to with all things in education is disparities. In other words, when you change something and intervene, does everyone benefit equally, or are there still haves and have-nots? And what this slide shows is the school diet quality by household income among children. So the one on the left is for low-income children, middle-income children in the middle, and then higher-income children. Now, of course, the first thing you'll notice is that the ideal diet quality, getting a score of 80 or above, that really high A+ score on diet quality, that's the, I don't know what color that is, dark blue, green, gray, I don't know. You can see almost no kids eat that diet. So we've got a long way to go, and it hasn't increased much. The joke in the United States is that it's only nutritionists who have the ideal diet, and probably even that's not exactly true, but so few people, you can't even count, it's almost zero. But the good news is that in the orange, the intermediate diet quality, We see increases in that with those new nutrition standards being implemented across the board, regardless of household income of children. And we see a corresponding drop in the number of kids that have a poor diet quality. And among children who are the poorest in our country, we see a drop in BMI as a result of those nutrition standards. That's recognized in the orange line on the top. If kids aren't in poverty, we don't see much change in BMI, but children that aren't in poverty tend to have a lower BMI to begin with. So the good news is that we are impacting BMI, and especially among those who have the most need to have a lower BMI. Impacts of the universal school lunch. So I didn't mention this, but about a third of schools in the country now, thanks to that community eligibility provision. Can you still hear me? Okay, I sounded quieter for a minute. About a third of schools are providing universal free meals. So instead of having the free, the reduced price, and the paid, everybody gets it for free. And in those schools, many studies have been done, and it has been shown that yes, absolutely reduces stigma. You know how I mentioned that the school meal program was starting to be represented in people's mind as a program for poor people. And therefore, you didn't want to go to the cafeteria and have the school meal because then you would be labeled as a poor person. Now, schools tried to do a bunch of things to make it so it wasn't obvious who was getting a free meal and who was getting a reduced price or who was paying. And the way they did that was to give everybody a card or an ID number, so you didn't actually have to have cash or no cash. But still, that reputation was in people's minds. So by providing everybody with universal school lunch, we saw less stigma and increased meal participation, less food insecurity or better food security, better diet quality, and also better academic performance. And I think we're going to have some other speakers today talking about that evidence. There's more limited evidence for a decrease in BMI. And two other things that you might or might not be thinking about yet, but there's some evidence to suggest that by providing free meals, it actually helps the overall household, because then the parents don't have to spend money to buy those groceries for the school breakfast, the school lunch, and the snacks. Interestingly, and your Secretary of State didn't talk about this, but some schools do not want to implement the program because they're worried about their bottom line, and I talked about how not everybody breaks even. When schools are allowed to provide universal school meals, you can say, well, why would that impact the bottom line? Because they don't have to do all that administration. And there is evidence that that does actually help the bottom line of the school food service, because they can save money by not having to do all of that additional work. All right, so just a few more numbers. 30 million children are served daily in the United States by school meals. 94% of K through 12. I don't think I mentioned that, but we have kindergarten through 12th grade. All K through 12 students will get the school meals. And even private schools can participate. It's mostly public schools that participate in the school meal program, but private schools can. The absolute cost is $18.7 million in 2019 before the pandemic. But the estimated savings, people have modeled this out. How much savings do you get in less healthcare costs, less food insecurity, less poverty? How much do you net save is 21 million. So as you are working to convince your legislature to adopt a school meals program, they will focus on the short-term costs. This is how much it's going to cost us. We have found that it helps to show them how much is it going to save you on the other end. And what our data show is that you actually get not only that 18.7 million back, but you save in other costs. Now, always politicians, they think about today, not necessarily 20 years down the road. And so this is where the translation of folks like you will help. You have to explain to them that you're not going to see those costs right now saved. You're going to see those costs in 10, 20, 30 years as fewer kids grow into adults with diabetes and hypertension and cardiovascular disease. So there's a little bit of translation work that happens, but these kind of numbers legislators often will respond to. But there's room for improvement. So I mentioned all the great strides we've made in the nutrition standards and why I hope you will adopt healthy nutrition standards to begin with. We found in a study in 2014 to 15 that only about 60% met all the daily meal patterns. 7.1% met all the weekly meal pattern requirements. So only about a third of schools are fully meeting all those nutrition standards. So we have still a lot of work to do. The new standards are in place. They're all supposed to meet them, but it takes time for them to change what they're doing and to meet those standards, and we have a ways to go. The other problem that we have in school meals is food waste, and I don't know if you've started measuring that yet, but people have actually gone to schools and done plate waste assessments where they've measured how much were the kids served, how much did they take, how much did they leave on their trays afterwards. Tremendous amounts of waste. Not surprisingly, perhaps, you'll see that the biggest waste is in vegetables, the smallest waste is in meats, but still 14 to almost a third of what is served gets thrown into the garbage and not eaten. And this equates to about $1.7 billion annually in food that is basically not going where it should go. We do have some evidence-based strategies to reduce school meal waste. These come from a variety of studies, and this is what the literature suggests: more meal options, more palatable and culturally appropriate options, pre-sliced fruits, so instead of giving a whole apple, slicing it up so kids can bite it. Reward students for trying fruits and vegetables. What do I mean by a reward? They've done different kinds of interventions where you get a sticker, you get your name on the board, you don't actually get money. Sufficient time to eat. In the United States, the average amount of time kids get for lunch is 15 to 20 minutes. That includes the time to get from your classroom to the cafeteria, to stand in line to get your food, to sit down and find a place to sit, to open up your lunch and to eat it. So it's not a lot of time, and more time results in kids wasting less. Recess before lunch. What typically happens is kids get released to go to lunch, and then as soon as they're done with lunch, they can go to recess, go out to the playground and play. And depending on the kid, a lot of kids find it more fun to go out and play than to eat. And so they'll sit down, take a bite, throw the rest away, and run off to recess. What we found is that if you allow them to play first and then sit down to eat, then they're less likely to hurry up and want to be done with lunch, and then less access to competitive foods. We figured out a lot of ways to reduce school meal waste. Why is still the $1.7 billion of waste happening? Because most schools don't implement these. These are research-based strategies. I'm just about to end. School nutrition education, we have none, or very little. It's interesting that even as far back as the 1970s, school nutrition education was considered a priority, but we've yet to implement it on a wide scale. So on average, kids see 2 hours per week in food ads on television and other media, most of which, 95 to 99%, is for unhealthy foods. How many hours of health education do they get? I gave you a hint, it's 5. What is it? 5. It's 5 hours per year. Big problem. Finally, I just want to tell you a little bit about some interesting things that are happening, and that is that states are passing free school meals for all post-COVID. I happen to be in one of the states that's doing that. So starting in 2020 to now, the federal government has provided free school meals to all students. That's supposed to end in this month, so that next school year, kids go back to free, reduced price, or paying fully. but 2 states and now a 3rd state on my flight passed a law that will give free school meals for all. And I'm not going to have time to share all this data, but what we're seeing is that food service directors are saying this is excellent. This is helping reduce stigma. It's helping reduce, increase meal participation. So we're starting to see some of those payoffs already, but there are still some barriers. So as you are thinking to pass this legislation in Norway, you'll have to figure out what barriers the students and the school food service are presenting, because we're seeing a lot of kids being tired of the same old foods. They're saying that they like their meals from home better. They say that their friends don't eat the school meals, and I think there's a poster out there about how school meals are social, and if your friends aren't in the cafeteria eating the school meals, then you're not going to eat the school meal. So there's a lot of barriers to getting everybody to participate. Interestingly, during COVID, the major challenges we've seen are due to supply chain. Have you guys had supply chain issues here? So many of the schools order their foods from a vendor. And I would caution you all as you begin to implement school meals to think about that, because the vendors have the advantage in that they're central. They can have a centralized staff. They're not just hiring kitchen staff at a school for a few hours a day. They can provide meals at less cost. The problem is they also provide less quality. So those kinds of vendors tend to, in the United States at least, provide things like Pizza Hut and fast food. It all looks and tastes like fast food as opposed to healthy food. And huge companies have set themselves up to be able to meet the need of these 30 million lunches and meals served per day. And so we have a lot of issues with providing all of those school meals during COVID. I'm going to leave you with just a few of the issues that I hope we can talk about during the conference, things that we haven't figured out. They include food and packaging waste. I haven't even talked about that. Organic, local, and vegetarian options, meeting the existing standards, updating them, and then school meal promotion. And I'm going to stop there and thank you all for your attention.